be noted, and I give the call to the member for Higgins.
Thank you, Deputy Speaker. Deputy Speaker, endometriosis is a really common disease. It affects 1 in 9 women, and diagnosis takes 7 years on average. That is far too long. It doesn't take 7 years to diagnose cancer. Patients also typically wait between 1 to 4 years to see a public specialist, like a gynecologist. Way too long, way too long. It's like adding insult to injury. I had the privilege recently of visiting one of the 22 endometriosis clinics that this Labor government has funded, something spearheaded by Assistant Minister Jed Carney. At the each endometriosis and pelvic pain clinic in Ringwood East, the wait time is not 4 years, but rather 14 days. The each clinic is a patient-centred clinic delivering essential services to women and girls who suffer from chronic pain. Patients walk in often with wads, files of notes. Many of them have had years of surgeries, and they come in desperation, having wandered from pillar to post in search of answers. There is no cure for endometriosis, but there is care. Care to help women navigate their lives and find options that may enable them to remain productive and fulfilled and not be defined by pain. Using a multidisciplinary approach, patients are met with empathy and expertise. Such is the reputation of this clinic that patients from regional areas like Gippsland are coming through word of mouth. Medical and nursing consultations, counselling support, pelvic pain management, physiotherapy, dietetics, an on-site ultrasound, very unusual, and hormonal treatments, including Mirena insertion and removal. These are the services this clinic provides, and these are the services our Australian women need, not just in Ringwood East, but all throughout this country. It's something that we are pushing. The only ask from me from this clinic was for more space. What a good problem to have. They are so overwhelmed with business that they just need some money to expand the clinic. I would like to thank the clinic for its professional staff and for providing high-quality care to our women and girls. Keep going. Deputy Speaker, bowel cancer. Bowel cancer is reaching down to younger and younger Australians. It is the reason we have expanded access to free bowel cancer screening to include people aged between 45 and 50. 1,716 Australians, each with a name, each with a story, each with loved ones, under the age of 50, are diagnosed with bowel cancer. That's 11% of all bowel cancers, and the numbers are accelerating. They are going up for a multiplicity of reasons. We are not clear why this is happening. 315 people under 50 die from bowel cancer each year. Imagine that. People at the peak of their lives. That's nearly 6% of all bowel cancer deaths. Over 86% of people diagnosed with early onset bowel cancer experience symptoms. So the majority of these patients actually have symptoms, and they go and see their doctor with them, often, sometimes with bleeding, a change in bowel habit, or pain. And yet, what do they hear? They hear, "You're too young to have bowel cancer." The signs and symptoms are attributed to hemorrhoids, to maybe food intolerance. It's a normal part of your recovery from having a baby, or it's the result of having a hectic lifestyle. How many times have these narratives been going round and round? And it's led to deaths, poor outcomes. And it's a tragedy, because if a polyp is found early, it's removed. It's snared through a colonoscopy and it's removed, gone. Bowel cancer stopped dead in its tracks. I'd like to thank Never Too Young, a bowel cancer patient advocacy group, for campaigning for the change to the bowel cancer screening program and spearheading this push for greater recognition. This Labor government, thanks to Mark Butler, the Health Minister, has listened.